I call the Honourable Member for Forest.
Thank you, Mr Deputy Speaker. Australia has a very proud history in the field of immunology. And even though penicillin, arguably the most important breakthrough in modern medicine, was discovered by Sir Alexander Fleming, a Scottish biologist, it was actually Howard Florey, an Australian pharmacologist, who conducted the first clinical trials of penicillin and really made it useful and effective. Howard Florey is estimated to have saved over 200 million lives since his discovery. Prime Minister Menzies described Florey as the most important man ever born in Australia. Now, the science has conclusively proven that immunisation is an essential part of modern healthcare. It has significantly contributed to the eradication of smallpox, the first disease that was completely defeated and eliminated. And we understand very well how vaccines prevent diseases. They reduce the risk of infection by working with the body's natural defences to help it safely develop immunity to disease. When germs such as bacteria or viruses invade the body, they attack and multiply. And that's an infection, and it's infection that causes illness. The immune system then has to fight the infection, and the body is left with a supply of cells that help to recognise and fight that disease in the future. And of course, the government understands the importance of immunisation, which is why we introduced the Australian Immunisation Register Act of 2015. This legislation created a new, consolidated legislative framework for the establishment and ongoing management of Australian immunisation registers. This bill, the Australian Immunisation Register and other legislation amendment bill of 2017, is a further part of the government's very firm, clear and absolute commitment to a no jab, no pay program. This program actively encourages immunisation and vaccination to lift the rates of safety for our children and for the children of others with whom each of our offspring play. And Mr Deputy Speaker, we know how children play. Any parents here in the chamber, or even grandparents, know that when children are young, how quickly a cold or virus spreads around, be it daycare, a preschool, a house, or when one got sick. I believe that there is overwhelming scientific evidence supporting immunisation, not the least of which is to protect our children, our precious children, from infectious diseases. Put simply, vaccination saves lives. And I was particularly, I think like all of us were, there was a family of a baby who died of whooping cough in Perth in 2015. And his name was Riley John Hughes, and he died at Princess Margaret Hospital. And the family certainly took to social media at the time, not only just to share their grief, but also in a desire to help eradicate the disease. And they were encouraging people to make sure that their children were vaccinated. And in the days, as was covered in the news, that in the days before Riley's death, Mrs Hughes made an impassioned plea to other families to consider vaccinating their children against the disease. And she said, if you haven't been immunised against whooping cough, please consider getting it done. Heartbreaking to watch 4-week-old Riley struggle with it at PMH. Please keep him in your thoughts. And for every parent, this is the last thing that any of us would want. And the Australian Medical Association President, Michael Gannon, in the article also said that the case was a very tragic reminder that people needed to get vaccinated against potentially fatal infections. And of course, this is exactly why vaccinations are so important. The Centre for Disease Control and Prevention estimates that vaccinations will prevent more than 21 million hospitalisations and 732,000 deaths amongst children born in the last 20 years. And more than 3 million people actually die from vaccine-preventable diseases each year. Approximately 1.5 million of those deaths are in children. less than 5 years of age. What better reason could there be for vaccination than that? And of course, we've had the 2015 Observance of World Immunisation Week. And I want to commend the Rotary clubs right around Australia in their great efforts to deal with the global polio eradication. And they've also then taken this further into measles as well. And in working with the World Health Organization, UNICEF in the US, Centers for Disease Control and Prevention, and Rotary, they joined together in 1988 with the absolute goal of protecting the world's children by eradicating polio. And they've worked constantly ever since. And over these years, Rotary and its partners have actually reduced the number of polio cases by 99%. And there are now only 3 countries in which polio transmission has not been stopped. And I want to commend all of the Rotarians, like those in your electorate, Mr Deputy Speaker, who've committed so much of their efforts and resources to this program. And of course, these polio assets have been applied in tandem now to measles elimination with similar strategies to deal with this. And I encourage Rotary to continue in this. The Polio Plus was launched in 1985, and I commend them for all of their work in this space. And this legislation is about a range of matters, but also about ensuring safety across the board and the importance of vaccinations, including measles and mumps. It's about rubella. It's about shingles. There is a vaccination for shingles, and it's about the tragic outcomes that I mentioned around whooping cough. And these, of course, Mr Deputy Speaker, are preventable deaths, absolutely preventable deaths. And immunisation is critical to maintaining public health and preventing the outbreak of infectious diseases. I'm pleased that the government's approach to vaccination for young children has support from both sides of this parliament. The Turnbull government is committed to further improving vaccination rates. Since the introduction of the no jab, no pay policy, the government has seen 200,000 extra children vaccinated in just over a year. This has meant that vaccination rates have increased, practically increased, to 93% for the general childhood population and to 94.5% for those covered by the particular measures. And this is, Mr Deputy Speaker, fundamentally good public policy. It is fundamentally good public policy to ensure the good public health outcomes for Australians. At the most important level, that level of individual families, it is good public policy that protects and saves lives. And you would understand that, Mr Deputy Speaker. I understand that your next child is not far away from being born. And so, of all people, you would understand and be very protective of your children and your babies and understand the critical nature of vaccinations. I know even Her Royal Highness Princess Mary of Denmark has recently lent her support to vaccination. She has seen firsthand the effect of infectious diseases in Africa. It just is another way of reinforcing the importance of vaccination right around the world. There are, like in each electorate, so many places that offer child vaccinations and so many opportunities for parents to make sure their children are covered. Since the introduction of the AIR Act, immunisation clinicians have requested that other specialised medical professionals have their assessments for medical exemptions recognised under the Act, in addition to general practitioners. And this is a fair and reasonable and very sensible proposal put forward by the medical profession further to advance the actual objectives of the no jab, no pay. These additional practitioners include paediatricians, very good idea, public health physicians, infectious disease physicians and clinical immunologists. Specialists have actually advised that having to send patients back to general practitioners for medical exemptions has added an unnecessary burden of time for patients, and in some cases may risk recognition of those families that actually have done the right thing. And in rural and regional areas, the more efficient we can be, Mr Deputy Speaker, the better. And the 4 specialist groups identified in the legislation today therefore provide care to the most vulnerable children in the country, including those with complex illnesses and healthcare requirements. This is a very sensible response put forward by the profession and is yet another example of the Turnbull government consulting with professionals and making changes to ensure the legislation is fit for purpose, the purpose of good public health outcomes. As the Minister did, I want to thank and acknowledge the work of the AMA and the Royal Australian College of General Practitioners. It is important that the government work with the profession to make sure that the no jab, no play policy is effective. Mr Deputy Speaker, it's important to acknowledge the bipartisan support lent by the opposition. I understand they've also been a very constructive partner in the push to ensure that vaccination becomes a universal outcome for Australian children other than those with a genuine medical exemption. Mr Deputy Speaker, the Prime Minister has made this a signature personal area of investigation and action in terms of preventive health, public health and protecting children, and he deserves great credit for ensuring the focus on this area. I strongly support this policy and make no apologies for the tough stance this government's taking on the vaccination for our children. I commend this, the Australian Immunisation Register and Other Legislation Amendment Bill 2017 to the House, and I'm sure that every member of this place is greatly committed to the health of children and babies, and and that is why there is such widespread and bipartisan support for this important bill. I commend it to the House, Mr Deputy Speaker.
I thank the member.